Good evening. I will now call the Finance and Corporate Services meeting to order. Tonight's meeting is being held with the members of committee and executive management team and deputy city clerk in the council chambers. Councillor Harvey is joining us remotely. Members of the senior leadership team and other staff are available to answer questions in person and via video conference as required. There are no open delegations, and we do have one presentation. The presentation is concerning the County of Simcoe Health and Emergency Services provided to the City of Barrie. I would like to now call upon Jane Sinclair, General Manager of Health and Emergency Services from the County of Simcoe, to provide the presentation.
Good evening, everyone. Can you hear me okay?
Yes, we can. It's a little quiet.
I'll try and talk a little bit louder. Please let me know if you can't hear my presentation. And I would like just to mention, before I start into the presentation, I have two other individuals who are joining me in the background and certainly will be available for questions after the formal presentation. I have our Deputy Chief of Paramedic Services, JC Gilbert, joining me. And I also have one of our 4 long-term care homes administrator, Tanya DeVries Porter. She is our administrator from Trillium Manor in Orillia. So they're joining me for the tougher questions after the presentation. So with that, I'll jump right into our presentation. If we move to the next slide, please. So I will be presenting on both paramedic services and long-term care. Next slide, please. This first slide is just an overview of our cost sharing agreement. So on the left side of the slide, you can see for paramedic services for 2021, our cost sharing was approximately 25%. For paramedic services, our agreement focuses on weighted assessment, tax assessment. And for our long-term care, our cost sharing for 2021 was 10.6%. And it's a little different cost sharing agreement given the nature of the service. So it is comprised of 35% of the cost is based on weighted tax assessment, 65% is based on resident days. And on average, I think we have budgeted for 2022 approximately 19 residents for the city of Barrie, and we will bill on actual days. Next slide, please. This is just a quick review of our legislative requirements. As a regional level of government, we are responsible. We are the designated delivery agent for paramedic services for the entire region. So the 16 County of Simcoe municipalities, as well as the 2 separated cities of Barrie and Orillia. Next slide, please. I'm going to talk about the operations component of paramedic services. In the first part, we'll look at the 911 emergency medical response component, obviously the largest component, but not the only component of service delivery to the city of Barrie. The County of Simcoe Paramedic Services, we provide both primary and advanced care paramedic service. It is a county-wide system. I do mention about the seamless principle because I think it's a really important component of understanding how our service works. So on a macro level, looking at the County of Simcoe with neighboring regions and counties, the District of Muskoka, for example, the closest vehicle responds to the call. So if, depending on the activity level, if things are very busy within the County of Simcoe, at times an ambulance or rapid response vehicle from York region may respond to a call if they're closer initially. Dufferin County, District of Muskoka, et cetera. On a micro level, looking at the city of Barrie specifically, again, oftentimes if we're have a high activity level within the city, we may actually pull in ambulances, paramedic services from neighboring or adjacent municipalities to respond to calls if they are the closest call. Within the city of Barrie specifically, our deployment is from a hub and spoke model. The hub being the new Barrie Simcoe Emergency Services campus. Initially we had focused on 16 posts as part of that hub and spoke. We actually have 5 posts given the Innisfil intended to be a post has actually become larger and is actually a station. And looking at our resource deployment within Barrie, we have 5 fully staffed ambulances in a 24-hour period. 4 are 24 hours, 1 is a 12-hour ambulance. We have 2 12-hour rapid response units. And then we have a number of adjuncts in terms of peak time activity. So we do have a 12-hour ambulance Saturdays, every Saturday throughout the year because of the call volume increases. And we also have 1 12-hour ambulance on Fridays during, again, peak time, June through September. Next slide, please. Looking at average call volume, you can see the table at the top of the slide gives you some historical data in terms of our total calls on a countywide and then on a citywide basis. And roughly on average for the past 5 years, the city of Barrie has represented just under 33% of all of our calls across the entire region. In terms of average response time, again, you can see the trending county-wide response times, average response times versus the city of Barrie. On average, over the past 5 years, it's been roughly 6 minutes, 24 seconds has been the average response time for the city of Barrie. Next slide, please. The next slide looks at our funding formula for paramedic services. You may be familiar. There is a commitment from the Ministry of Health for 50-50 cost sharing for paramedic services. In 2021, we actually achieved 50%. I think it was actually 50.2% of funding from the province. We were thrilled to see the full funding commitment. If you look at the table on the screen, you can see the actual provincial funding levels since 2002, and you can see, unfortunately, it has not met with the 50%. Certainly the last 5 years, we've been much closer, but typically we're a little bit under, and I'm going to talk a little bit about the formula. So the ministry formula is based on approved operational expenditures for the County of Simcoe paramedic services, plus a factor for capital depreciation. However, the funding is based on the prior year's approved budget. So in essence, we're always 1 year behind in terms of our funding from the province. And so if we add resources, for example, if we added resources, which we did in 2021, we don't actually see an increase in funding until the following year, subject to provincial approval. The other piece that I'll mention is we do receive targeted funding for dedicated offload nurse funding. That is 100% funded. It's not cost shared by the city of Barrie, and that is to put additional resources. This resource is specific to the Royal Victoria Regional Health Centre, where we have our largest call volume and patient offload times. Next slide, please. So the next slide delves into the other part of our operational service that we are providing on a regional basis, as well as to the city of Barrie. And this is our community support. So the first component is public access defibrillator, or a PAD program. And I will note, this is a sustainable funding model. So the city of Barrie does not contribute to this funding. The revenues from the sale of the defibrillators and the maintenance program actually pays for itself. We have 314 defibrillators in the city of Barrie. And we have 170 organizations that have ongoing maintenance and education programs with us. And I believe we've had 10 saves to date. within the city of Barrie since our program, 13 saves to date since our program started a number of years ago. And on the other side of the community support program side, this is an ever evolving component. It's our community paramedicine. And I'm very pleased to say that we have recently expanded to include service in the city of Barrie. We started with community paramedicine approximately 6 years ago, hybrid model. It was within our emergency response program, so we didn't have additional paramedics providing this. We had specially trained paramedics that were doing both emergency response as well as community chronic disease management calls. We are fully funded at $266,000 annually, and that's for the oversight piece, the management, data analysis, and equipment. But most recently, we've expanded through funding from the Ministry of Long-Term Care. And there's a 4-year one-time funding program that we're currently approved for between 2021 and 2024, the end of 2024. And this is so that we can expand this community paramedicine across the region. And it is for chronic disease management, and it's for individuals who are either on wait lists for long-term care or are eligible for long-term care placement. And we did start, as I mentioned, to expand this program in the city of Barrie, and we currently have 115 patients within Barrie alone on this program. So we look forward to bringing further updates. And again, this is a different funding model. So the city of Barrie does not actually cost share in this service provision. This is fully funded through the Ministry of Long-Term Care. And the last piece of our community paramedicine is vulnerable sector community paramedicine program. And this is through what we call HISH funding. So it's a high intensity funding program. And we have paramedics that provide wellness clinics to vulnerable populations or homeless population. Currently, we have visits to the one site in the city of Barrie on a regular basis. And again, this has been fully funded through the Ministry of Health. Next slide, please. The next slide looks at our capital planning for paramedic services. You can see a chart on the screen. We have a 10-year facility plan from 2021 to 2023. We have a predictive model. We brought in some external consultants to actually help us determine the best locations for our facilities, for the best to really optimize deployment and obtain the best response times possible. And you can see the number of factors that are part of this modeling tool. With that, we currently have 18 stations and 17 posts. As I mentioned, in Barrie, we have the new emergency services campus, and will be, when fully operational, have 5 fully operational posts that coincide with the campus model. And we do have a special agreement with the city of Barrie around the financing or the funding of our capital planning and capital expansion that is spread over a 10-year period, where the city pays approximately 10% over that 10-year period, and with very low financing rates comparable with the Infrastructure Ontario. So that is a process that we have in place right now. Next slide, please. The next slide looks at operational efficiencies. These metrics we review annually, and we report to County Council. And it's really tells us how we're doing in terms of our efficiencies. And as you can see on the chart in front of you, this is a municipal benchmarking. It's a Canada-wide benchmarking program. And you can see the median municipal results where most of the services sit. It's around $232. We break it down on a cost per weighted vehicle. So total cost of all our vehicles in a year, divided into an hourly rate. And then we compare ourselves in that regard. So the median's 232, the average is 237, and the County of Simcoe sits at 208. Next slide, please. And this is another metric that we also monitor and report to County Council in terms of our efficiencies. One of 3 emergency services. We pull the costs for paramedic services, for all police services, and for all fire services across the region. And you can see there's a graph and a chart below so that we can, again, monitor ourselves in terms of where we're at for efficiencies. On the graph at the top of the slide, paramedic services is represented by green, the green solid bar. So that's our total cost structure. And the dotted line represents the actual municipal costs because with paramedic services, as I mentioned, there's a 50% cost sharing formula with the province of Ontario. Next slide, please. So I can stop now, or I can keep going and review the long-term care and then take questions at the end, if that makes sense. I'll keep going. I'm not hearing any, if that's okay. So moving into long-term care, again, just to touch on the legislative requirements, this just speaks to municipalities and their requirement to operate a home. In our case, the County of Simcoe operates homes on behalf of the 16 local municipalities, as well as the cities of Barrie and Orillia. Next slide, please. Just a very high-level summary. We have 4 long-term care homes within the county. We currently operate 544 long-term care beds, 24/7 nursing and personal care, some highlights: social, recreational, mobility support, Montessori program, which really focuses on the increasing number of long-term care residents with dementia or cognitive impairment, and then respite services. We have 7 respite or short stay beds for individuals in the community that we operate from our 4 locations. Next slide, please. This is another aspect of our long-term care program as well. These particular components, I'll speak to the funding because they do impact City of Barrie. There are 10 long-term care homes in the City of Barrie, and we operate what's called a regional program, geriatric mental health, a team. It was formerly called Behavioral Supports Ontario. We have approximately 35 staff, long-term care staff, that are dedicated and specifically trained in behavioral support. And they actually work and operate in all of the 26 long-term care homes across this region to provide support to the staff in the homes, to the residents and the families. And so we work in close partnership with Waypoint Center for Mental Health to deliver these services. This is funded separately, flows through Waypoint from the ministry, and is not part of the cost sharing with the City of Barrie or City of Orillia. The next item is a behavioral support transitional unit. So part of this specialization that we deliver, we have just been approved to operate a new regional behavioral support unit. It will operate out of our home in Penetanguishene, Georgian Manor. It'll be a 16-bed unit. And this is for individuals that have really specialized needs, more intense needs that can't be managed safely in long-term care homes or often in hospitals. So the Royal Victoria Regional Health Centre, for example, may have patients that are really not suitable for long-term care in their current status, don't belong in the hospital, really need special support to stabilize them so they can move into a long-term care home. So when this is open, those types of individuals will be priority for this behavioral support unit. And there isn't one in this area. This has been in discussions for over a decade, so we're really excited about this new opportunity. And again, the funding for the specialized component is special funding that won't be part of City of Barrie cost sharing. The next item is digital coordinator. We have another long-term care role that we are funded for specifically, not part of the cost sharing. Again, is dedicated to all 26 long-term care homes, including the 10 homes in the City of Barrie. And they actually support the homes for telemedicine so that the residents in these homes can receive a specialization in terms of assessment and treatment through telemedicine. And the last area, which is part of our funding, regular long-term care funding, is a regional dialysis program. We're in partnership with Orillia Soldiers Memorial, and we operate a regional dialysis program in both our Trillium Manor, which is in Orillia, and our Simcoe Manor home in Beaton. These are the only two of the 26 long-term care homes in our region that offer this program. So if you have a resident in the City of Barrie that needs long-term care but has dialysis needs, these would be one of these two homes would be the homes that they would be admitted to, so they could receive that specialized care. Next slide, please. A number of operational considerations I wanted to mention. In the last couple of years with the pandemic, and I know you'd be very familiar with the increased vulnerability and the increased strategies in long-term care homes across the province. There's been a significant change in our operations. The reference to full-time declarations as one of the strategies to ensure all long-term care homes had enough staff, having to have screeners and additional protocols. We offered full-time positions to all staff, part-time and casual alike. And just to maintain the staffing, we were actually directed by the province to do this. And so with that, it did help secure additional resources, which was excellent. But there are obviously additional costs, as well as PPE, masks, gowns, gloves, etc. The COVID funding that we have received for our long-term care homes and senior services has fully covered those costs during 2020 and 2021. And we do have additional COVID funding in 2022 as we start to move back towards or move into a new normal with hopefully the ending of the pandemic at some point in time. The other component I wanted to mention is human resource management. Again, I'm sure you're familiar with the challenges for long-term care. Pre-COVID, there were significant challenges with shortages in many of the positions in long-term care homes across Ontario. It has only been exacerbated during the pandemic. And so that's something that we continue to strategize to ensure stability in our staffing levels, using agency agency staffing at an unprecedented rate during this pandemic, and again have been impacted by significant price escalation in terms of costing for these additional resources. And the other component I'd mention is with the increased focus on IPAC expertise and education in this area, we have added additional resources, and we are now starting to see permanent funding being announced by the province to support these positions. So that is very good news. Next slide, please. This is just a very quick overview of our funding, provincial funding from the Ministry of Long-Term Care. Essentially, there's 4 primary funding envelopes for all long-term care homes, whether they're municipal, whether they're charitable, not-for-profit, or for-profit, same funding. Nursing and personal care, program and support services, raw food, and other accommodation. You can see the rates on this slide. And then in addition to that, there's a global per diem. They started a few years ago. On average, it's about a 1.5% increase. And the range is anything from anywhere from $7.27 to $7.38. And all of these funding per diems are they're based on a per diem. So it's $7.27 per resident per day, calculated over a year, 365 days. So that's how the funding model works. So in addition to the operational funding, there is something that's fairly new. They started it in the last couple of years. It's called minor capital funding. The county has most recently received on an annual basis $247,000. And just so you understand the formula, it's every home gets a base funding of $5,000 plus $1.42 per resident per day. So that gives you an overview. Next slide. And the one thing with the provincial funding is there has been a long-standing funding shortfall for long-term care. That has been there's been significant advocacy from AMO, from there's several long-term care associations, advocacy associations, about the funding shortfall. As a municipal provider of long-term care, we do on average provide higher levels of service than the other sectors. And so in the County of Simcoe's example, we do subsidize over and above the provincial funding, which is what the city of Barrie cost shares in, that gap between provincial funding and what municipal funding to ensure that we have more appropriate levels of staffing in our facilities. Sorry, next slide, please. The next piece is a new piece for long-term care funding. And you may have been watching this in the media as well, because of the longstanding advocacy, and in particular during COVID, there was a commission that was undertaken with the number of deaths that occurred in long-term care homes across the province. And one of the key findings was a level of care and need for additional funding. And so one of the very positive things that we've seen arise from such a tragic situation is a commitment by our provincial government to increase funding to increase the level of care and services in homes across the province. I think the average at the time of the announcement was about 2 hours and 2.75 hours per resident per day of direct care. So that's nursing and personal care. And so the mandate, you can see it's a 4-year phased approach. By the end of March this year, homes on average are to have 3 hours per resident per day. And then you can see increasing 2023 to 3 hours and 50 minutes, 2024, 3 hours and 42 minutes. And then by 2025 to increase to 4 hours of care. We have received initial allotment for the last quarter of 2021, where we have increased our staffing levels accordingly. We have since received commitment for funding for 2022. And the provincial fiscal timeline is different than ours. We run on a calendar, January to December. The province runs April 1st to March 31st. So there's a bit of overlap in calendar years. And so we'll continue to monitor and keep council and Barrie and Orillia updated as we move forward with that. Next slide, please. So the next component of long-term care is the capital side. I did talk about minor capital. And minor capital is really the maintenance of the existing facilities. So when roofs need to be replaced or upgraded, replacement of windows, flooring, those types of things. That's that capital component that I talked about. Capital redevelopment is the other side of the equation. And I think it's timely to just touch on this. As you will be familiar, we have a significant capital redevelopment program currently underway with our redevelopment of Simcoe Manor. So that's our home. It's a 126 bed home in Beaton. We've been approved to add 34 additional long-term care beds, and we will be developing an entire campus continuum. It's modeled after our Georgian Village campus in Penetanguishene. That's been very, very successful. In the Penetanguishene model, we were able to increase the beds as well and build a number of seniors housing and services. With the increased beds, we were actually able to reduce the municipal levy component, the tax levy component, because of economies of scale, some efficiencies, and the whole senior side of that equation, the housing and services, are all a sustainable model. So there's no tax-based contributions. All revenues received for the housing and the programs offset all of our expenditures. And in fact, we contribute, I think, close to $500,000 annually back into reserves to help maintain the capital infrastructure and the services. So Simcoe Manor development will be very, very similar. It's actually even larger. It's a larger population base that we're serving. So it'll have a few more housing. And the city of Barrie will only be contributing a cost sharing on the long-term care home development portion of this development. The only other exception is we are including affordable housing facility, 32 bed affordable housing. And so that will be part of the social housing component for capital cost sharing purposes. We have been approved by the ministry. We have a development agreement in place, and we are working on finalizing our designs and moving to begin tendering later this year in the last quarter of 2022. And you can just see the funding. It's all on a per diem basis as well for capital funding. On the Georgian, the other piece that I will mention is Georgian Manor. So that's our home in Penetanguishene. We have been approved, and this is a mid-year approval that happened earlier this year. We have been approved, as I mentioned, for a 16-bed behavioral support unit. And so with that, we've also been approved to expand and add 16 more long-term care beds to ensure that we maintain the existing bed capacity. And we're anticipating a fall construction start for that. And with this capital redevelopment, we, with both of these, as I mentioned with Georgian Village, with the additional beds, that does bring economies of scale with the additional revenue, resident revenue, that we will be anticipating decreased impact on municipal contributions as a result once the additional beds are up and operational. Next slide, please. This just really recaps the components that I talked about: Simcoe Georgian, economies of scale, and in addition, capacity. So, for example, adding 34 more beds to Simcoe Manor. Again, that avails more capacity for applicants across the region, including the city of Barrie. And with adding 16 additional beds, we're able to maintain, but we're actually adding in 16 very specialized long-term care beds. And again, those beds will be available for applicants across the region, including city of Barrie. Next slide, please. This is, again, very similar to the slides that I had with paramedic services. These are part of our ongoing performance management, quality risk management component. These are metrics that we review, report to county council, and we monitor closely. The table on the left looks specifically at comparators budget levy. And you can see we have a number of counties. We also have some additional regions that we compare as well that aren't listed on the screen. And we are the lowest for all the regions in comparison, and for the counties, we're amongst the lowest. You can see our average is $42.50 on a per resident a day, roughly half or a third of many of the other comparators. With the exception of the District of Muskoka, which has one home, 160 beds, which is that kind of magic number for efficiencies, and they have a high CMI. And the table on the right, you can see it's a different comparator. That's that Canada Network municipal benchmarking again. And so these are operating costs, and you can see the median to 257. You can see where we set it 244, and you can see the range of cost comparison. So again, we're amongst the lowest or one of the lower regions or counties through this benchmarking comparison as well. Next slide, please. That's the end of our slides. I tried to move through them fairly quickly. I was told we had 10 minutes to present. So I hope this information was helpful. And at this point, we'd be happy to take any questions.
Well, thank you, Ms. Sinclair, for that exceptionally well narrated report presentation. At this point, are there questions from members of committee? Acting Mayor Ward.
Thank you, and thank you for the presentation, Ms. Sinclair. I only have one question. It was out of curiosity. Early on, there was an early slide that mentioned how a 12-hour ambulance shift was added in Barrie on Fridays in the summer. What is driving that? Why do we need an extra shift Fridays and only in the summer?
Thanks very much for the question. I'll start this, and then I'll look to Deputy Chief JC Gilbert to expand. But when we have targeted resources like this, it's based on calls or call volume. So when we see a peak or an increase in calls, whether it's a certain time of day, a certain time of year, in certain locations, because we monitor that, then we will try to adjust for that and put additional resources, anticipating that in this case, we have the 12-hour Saturdays. We have increased activity on Saturdays, but I'll look to Deputy Chief Gilbert to expand on that.
Yes, thank you, Jane. You're absolutely right. It's about call demand that comes to us on the weekends. We get a lot of activity coming through the city of Barrie from a vehicle and a visitor perspective, increasing call volume in the area, but also more recreational activity begins on the weekends, which also helps drive that volume as well.
And Deputy Chief Gilbert, in the summer, June, September, so we add Fridays on top of that. So assuming it's related to probably an influx of visitors to the area, increased activities, vacation, etc. But if you wouldn't mind commenting on that, that would be appreciated.
Yep, sure, absolutely. We definitely see a spike and an increase in the nicer weather, people traveling through to cottage country, people stopping in Barrie and spending more of their time here. The downtown area gets busier, more recreational activity on the water, and then just the increased population leads to more call volume.
Thanks very much.
Okay, thank you.
Thank you. My mic wasn't on, apologies. Councillor Harvey.
Thank you, Chair Harris. Just in one of your earlier PowerPoints, you spoke about 6 paramedic posts within our city. Are these physical locations, or are these like parking lot locations where they station themselves to be in the center of where potential calls could be in the near future?
Thank you very much for that question. So it's actually 5. So our original plan was a hub, which is the campus that we share with the city of Barrie. And it was intended to have 6 posts. They're physical posts. So physical locations where paramedics can report into. They start at the hub and then move into these various posts. We're actually at 5 because the 6th actually turned into a full station because of the needs in that particular area. So I've just got them listed. So we have Central East Barrie, which is Ross Street. That's the post that just opened. We have currently we have Barrie North, which is a station, but that will be we're in a lease situation, so that will be moving to a new post in Springwater South. We have Central West Barrie, which is kind of in the Ferndale Edgehill area. Has not been developed yet. Big Bay Point is another area we will be developing a post. And then southwest part of Barrie will be the 5th post. And maybe Deputy Chief Gilbert can just talk about the differences between a post and a full station or the hub, if you don't mind, Deputy Chief Gilbert.
Absolutely. Thank you. So the difference between the two physical locations between a station and a post. Post is very much smaller. It's not a reporting location, so we don't need to go through the additional space of needing locker rooms, changing areas, things like that. It really is a small crew area, a single bay garage, drive-through style, where the paramedics really we're trying to pre-position them in areas to improve our response capabilities in those areas where we know we have call densities. So the physical spaces are much smaller. And we don't report to them directly. We, like James Sinclair said, we do report to the hub, start our shifts, have a shift briefing, and then report out to those. And there's a resourcing plan per se based on time of day and call volumes that'll inform when we're at each post and how we go about backfilling those positions as the days go on, as the hours go on throughout the day.
So I gather those two, the posts that you spoke of in the south end, they don't exist to date then, correct?
Correct. We've got a station at Barrie Tiffin right now and one at Barrie North. They're pre-existing, they were inherited locations that the county received when upon taking on the paramedic service. And we still position out of those currently, as well as out of the hub and out of the new Ross Street post. So we continue to test the system and ensure that we're pre-positioning the appropriate manner for those locations. And as the new posts come on, we're going to look to get out of those leased locations and have a much better spread and be in owned facilities versus leased or rented space.
In the presentation, there was a slide that showed our 10-year program from 2021 to 2031. And it actually lists the stations and the posts developing each year. So I'm assuming the members of this committee will receive a copy of this presentation, because if you look at that slide, it'll say exactly when each of the posts for the city of Barrie, what year we plan to develop them, have them operational.
And just to follow up to that, and I know I've asked Chief Robert this exact question 2 years ago, but I'm going to ask it again. I work in a municipality in emergency services myself. It's a municipality that does do a lot of partnering with the local fire and police because it keeps down capital costs. We've got fire halls in our south end that are more than willing and capable of allowing an ambulance to be one of those posts that would eliminate that capital cost and be able to open those posts in very short order. Why is it that there's no flavor behind wanting to move in that and delay building these posts, which cause capital and also create a delay in actually servicing the south end?
So if you don't mind, I will start this and then I will probably look to Deputy Chief Gilbert to expand, but there's a couple of things. So one of the slides, I talked about this modeling tool that we have. ORH is a consulting firm that we engaged quite a number of years ago to help us. And it looks at calls, where are the calls occurring? It looks at a number, it looks at the population, it looks at aging demographics, it looks at all of these different factors, and it helps us plot out specifically where we need to deploy our staff, where we get the best bang for our buck, where we're going to see the greatest response capabilities by positioning, whether it's stations, hub, or spokes. So when we look at that, the nature of our business is different than fire services, although we partner with them and we know the City of Barrie Fire does participate in tiered response. our core business is emergency medical services. And so the deployment plan is based specifically on our business. So the locations of our deployments is not likely going to match up the same as fire services or police services for that matter, because our business needs are different. And so first and foremost, that really guides where we're putting these locations of these posts. And the second piece is, and we do have some very successful shared stations. And I'm going to use the Barrie Simcoe Emergency Services campus as a great example. In this case, it's police and paramedic services, but there's some obvious wins by co-locating these two services in terms of smaller footprint, shared amenities, et cetera, even just partnerships. But with fire and paramedics specifically, when you look at that tiered response, if both of those services are reporting from the same locations, there's zero response advantage in terms of getting there more quickly if both resources are coming from the same spot. So that's one of the significant considerations that we factor into our station locations as well, because we absolutely want to partner with the City of Barrie of other services, and we appreciate our partnership with fire services as well. We work very closely with them. But from a response time advantage, co-locating two services that are doing the same, not doing the same thing, but for certain types of calls like cardiac, for example, there's no advantage if they're both deployed from the station. So I'll stop there, and I'm going to look to Deputy Chief Gilbert to expand.
Very well answered. There's not much more that I can add to that besides spreading those defibrillators around the city. Having more vantage points from that cardiac response perspective is very much a driver in why we aren't necessarily co-located in those areas. Spreading more defibrillators to more areas increases our capability of getting there in a much quicker period of time for that most critical of emergency. And nothing more than what Jane has just said, that our business is very different, and having us in the same spot is not going to give us any sort of a capital gain.
Okay, thank you. Just another follow-up to that. Now, one of your charts from a cost perspective, you compared yourselves with many other municipalities. London and Niagara were your two closest comparators on a dollar value. Now, when I go into the Ministry of Health's website where it tracks the response times for all the different levels, now they only are posting off their level 1 CTAS calls. They both have a 2-minute response target, and London has a target of 80% and are reaching 82% of the time. Niagara has a target of 90% and are reaching it 73% of the time, whereas Simcoe County, instead of a 2-minute target, has an 8-minute target at 60% of the time, and you're reaching it 65%. Now, if they're able to deliver services at a very similar cost to what we are here in Simcoe County, why are their numbers so much better and with a 6-minute shorter response time target?
Through you, Mr. Chair, that's a great question. And we just recently did, in the last few months, we'll pull the report. We recently did a report to County Council on this very item and gave some data on not only our response targets, but those around. And even though the costing is one metric, response time is another totally separate metric, and it's really dependent on a number of factors. It's dependent on geography, it's dependent on population. Those are critical factors that so there's rural response versus urban center. And so it's not apples to apples. If you're just strictly looking at the costing, you have to look at those other variables that impact response times. And so what you're referencing is, I'm going to say about 5 years ago, the province changed our reporting metrics. Used to be based on the 90th percentile response time, and now there's 6 different categories. The first category is kind of an all response with a defibrillator, so that's paramedics, that's the public, any services that utilize a defibrillator, and then there's 5 categories, CTEST 1 through 5, which is varying levels of acuity. And so we set those targets based on each municipality, each service sets those targets based on their historical data, on what percentage of time of paramedic services arrive to those different types of acuity calls, CTAS 1 through 5, et cetera. And so if I may, I would like as follow-up to this session tonight to share that report, because it really details the differences from municipal service to municipal service, why those targets are differ, and even more importantly, county council, knowing what our historical response times have been. We've seen continuous improvement year over year since these new metrics were put in place, but they asked us to go further and establish what we're calling stretch targets. So we're not just going to be, every year we have to present our targets to the province, and then we, at the end of the year, provide how did we do? Did we meet 60%? Did we exceed? We're at 65, 70%. And so under council's direction, county council's direction, we've actually set targets, improved targets that we're not currently meeting. And we have a number of strategies. It's kind of a phased approach that we'll be working over the next 4 to 5 years to increase our percentages, to your question, Councillor Harvey. So it is a very complex reporting structure, but I think if we can share the report, it will help provide some of those details. And we would be happy to come back and provide a presentation even specific to our performance metrics and our response time if this committee would like that at some future point. And I'll look to Deputy Chief Gilbert to see if there's anything additional you'd want to comment on that.
No, I think that covers it. I'll have a look at those numbers though, and we'll come up with some more information going forward that we can report back to this group if you'd like.
Yeah, that would be great, because when I compare like the size of those municipalities, the fact that they do have urban and rural similar to us, it seems to be very similar in my perspective. Part of that reporting back too, I would also be interested, and again, this is another thing that I spoke to Chief Robert about a couple years ago, was dividing up the city and examining the response times in each sector of the city. I know he was able to then dissect it down to each wards, and then that's when we started identifying that you may be hitting overall targets, but when you start examining certain areas of the city, you are definitely not meeting those targets. And I'd be interested to see if something has changed in those 2 years from my previous conversation with the chief, because it is concerning when I see the numbers across the whole south end of our city not meeting those targets. Something needs to be done, and it can't wait years for a capital building to be built. And that's why I was really going down the road of we've got places available. Whether you believe it would assist in success rates, I guess that's a whole other debate. But the fact that it would actually assist getting an ambulance, paramedics who are trained differently than firefighters. Firefighters are not paramedics, and we never want that to overlap. But it really comes down to making sure that we provide the best services for our citizens across the city. And that's why I wanted to compare the north to the south. And that's when I identified that there was an issue here in the south end of the city. But I'll leave my comments at that. And I look forward to the information that you report back.
Absolutely, we're happy to provide some additional information. And I would expect we'll see some changes in response times. This year we added a response vehicle in the city of Barrie. I know there's been a number of changes over the past 2 years, enhancements that we've put in place. So we're happy to share updated information.
Great, thank you.
You're welcome.
Great, thank you, Councillor Harvey. Any questions from our members of council in attendance? Yeah, Councillor Reba, please.
Thank you, GM Sinclair, for your presentation. And I'm going to switch over to the long-term care part of it. And did I hear you correctly say that we have 19 people from the city of Barrie in your facilities?
So that's the number that we use for our budget. How we measure the number of residents, it's constantly changing. How we actually measure for cost sharing purposes is it's based on resident days. So for every resident that's admitted to any one of our 4 long-term care homes, we collect their address upon admission. And if they're residents of Barrie, then we track the number of days in the year. And then it averages out to, we report it on average number of residents. But there may be at some point, there may be 25, 30 residents, and other times there might be 15 residents. But based on our historical data and our most recent resident day count, we have budgeted, I think, it's part of the cost sharing, that 65% based on it's like caseload on resident days. That's what we have forecasted for 2022. Of note, however, we only bill on actuals. So if there was fewer than 19 residents in a year, we would actually bill on the actual number of resident days versus what we budget. Oh, and conversely, if there was more, then we would bill accordingly.
And I have a follow-up as well. Thank you for that answer. I think the city of Barrie is about 25 or 30% of the population of the county. And I noticed in your report, in your presentation, that you have 544 beds. And so 30% of that is about 160 beds, round numbers. And you're budgeting for 19. Do you have any thoughts as to why the citizens of Barrie are not using county long-term care?
Thank you for that question. I think there are a lot of homes. There's 10 long-term care homes located directly in the city of Barrie, first of all, and our 4 long-term care homes are adjacent municipalities. So we have one in Beaton, one in Orillia, one in Penetanguishene, and one in Collingwood. So Barrie residents certainly do reside in our homes, but the numbers are less than, say, for example, I'll use Orillia, for example, the city of Orillia. That home is actually located within the city, and so they have a higher concentration of residents from the city of Orillia just because of the location.
Okay. In the future, does the county have any plans to build a home in Barrie?
This actually question has come up a number of times, and I think the last presentation that we did to budget presentation to the city of Barrie, this question came up. At this time, we don't have any plans to build a facility in the city of Barrie. However, we do very much value and appreciate our partnership with the city of Barrie, and so we always welcome discussions and conversations about future planning needs and how we can work together. So at this point in time, we're focused on those 2 redevelopments that I spoke about. But we're always here to speak to staff at the city of Barrie and talk about future planning needs.
Okay, thank you. Thank you, Chair Harris.
Thank you, Councilor Reedman. And maybe just have a couple quick questions for myself, and GM Sinclair and Deputy Chief Gilbert. Just reflecting on slide 7, the paramedic service Ministry of Health funding and the 50% cost share. And if I missed it, I apologize. But I just wanted to know, curious if COVID funding has made an impact on reaching the 50% this year, knowing it hadn't been reached since 2010, and will that be expected again to be an impact or a driver for 2022?
Thank you for the question. COVID, we believe, has made an impact, and that's we feel probably why we hit the 50.2%, because we saw some really strange trends during COVID in paramedic services. Early on in the first couple of waves of COVID, we saw this significant change in patterns, healthcare patterns. People were not going to the hospitals. They weren't going to their doctors. They weren't calling 911 services. And so we saw a really significant shift in calls, decrease in calls, really unusual. But I think, we think it's related to the whole pandemic phenomenon, and people are afraid. And then as we've progressed, and so we didn't add, the same resources that we would have typically if we saw the anticipated year-over-year trending going into 2021. And so that we've had a bit of a catch-up period because, as I mentioned, funding is a year behind. So I think the short answer is yes. I think we saw some changes related to COVID that impacted our funding and actually increased our provincial cost share. This past year, as the pandemic has evolved, so has the trending that we've seen. And we haven't seen a huge spike in calls. We've seen it climb again. And Deputy Chief Gilbert can probably elaborate. But one of the things that now we've seen is more transports. So in all the 911 emergency calls paramedics respond to, there's a certain percentage that we actually transport to hospital. There's a certain percentage where we don't. They either sign off, they refuse to go, et cetera, et cetera. And what we've seen this past year is a kind of a balloon or a significant expansion in the actual number of transports to hospital. And I think generally speaking, the people that we're responding to are more ill. They are sicker. They have, comorbidities. And we equate it to this trend, this phenomenon where people were, holding back getting healthcare for lots of different reasons. And unfortunately, we've seen a population where they become more ill and more acutely ill. So this last year, particularly in the last half of the year, we've seen the calls really start to, not only more transports, but calls start to ramp up as well. And I looked at Deputy Chief. Any additional comments you want to add to that?
On top of those trends in more transports and some of the acuity leading to more paramedic resource demand, we're also seeing another shift again in the offload delay times because of the compression factor in the hospitals, the staffing factors in the hospitals, getting down to the emerge. Excuse me. We're seeing more time spent in hospital, which is leading to more resourcing challenges being compressed all the way through the hospital into our system. But those three factors, we've seen a significant increase in over the past 12 to 15 months, being, as GM Sinclair said, the transport rates, the acuity, but also the offload delay times in the hospital.
Great. Thanks for that level of detail. I was curious about there being a COVID effect and a post-COVID effect. So thank you for that level of detail. Maybe one final question. I was interested on slide 8, the Paramedic Services Community Support Program, particularly the vulnerable sector community paramedic program. And am I correct that the $230,000 was annualized ongoing funding, or is it project?
That has been annual funding to date, but this is new. We're not sure of the longevity. Right now, it's just on an annual basis. We're not sure if it will be one time or whether it will be ongoing annual. But I can tell you, this need developed out of a kind of a call for action from the community, from primary care, from physicians, and the community sector to help with the gaps with what we saw in COVID. And paramedic services, you know, because of their mobility and their ability to be very nimble, was able to establish these wellness clinics and really filled a number of different functions. So we anticipate, we're hopeful that this will be ongoing annual funding going forward, but it's still very early to tell.
Okay, thank you. Yeah, I was hoping that would be one of the items that you would be advocating for annualized ongoing funding. Just quick question. It's been topical in Barrie. I'm sure it's something that comes across your radar as well. As our community has an increasing number of individuals experiencing homelessness, and I was wondering if that population is included in the vulnerable sector type service, maybe current and future planning.
So that really is, this vulnerable sector group are the homeless individuals. And there's been a number of locations where community partners have housed these individuals. So the current location for the homeless is at the Travel Lodge that's on Maple Street in Barrie. And so that's the location that we're currently providing clinics, wellness clinics, et cetera. And then as that shifts, we'll go where the vulnerable sector supports meet us. So it could be multiple locations, but it is really targeted on the most vulnerable, and that would be the homeless population.
Thank you very much. And to you, Ms. Sinclair and Mr. Gilbert, thank you so much for the presentation and the questions and the detail provided. Greatly appreciated. Thank you.
You're very welcome. Very welcome.
Thank you.
So that will move us to our standing items, and we have none. We have no referred items. That takes us to our advisory committee reports. And we have 4 advisory committee reports to be received. The report on the Seniors Advisory Committee dated April 25th. Report of the Town and Gown Committee dated April 27th. Report of the International Relations Committee from May 3rd. Report of the Accessibility Advisory Committee from May 12th. And a report from the Town and Gown Committee dated May 25th. Can I have a member of committee put the advisory committee reports on the floor to be received? Councillor Thompson, thank you. Are there any questions from members of the committee? Acting Mayor Ward.
Thank you, Chair Harris. Maybe it's through you to Councillor Rietma. I'm just curious because in the Town and Gown Committee mentions about a housing review that they're going to share with council at some point. Do you know anything about when they might be doing that, Georgian College?
Thank you for the question. Excuse me. The Georgian College actually retained a consultant to take a look at the whole student housing question. And that report is coming out. In fact, I spoke with the representative from Georgian College today. And we're expecting that report to be available in the not too distant future. And Town and Gown Committee has actually asked that the person that wrote the report, which is a very reputable and experienced consulting company, actually, that person come to the Town and Gown Committee and talk about the report. I haven't seen the report yet, but it just from what I hear, snippets of it, it's got some interesting ideas in it.
Just follow up. So it will be shared with council at some point, as far as you know?
As far as I know, yes.
Thank you.
Are there any questions from members of council in attendance? Seeing none. All in favor? So we have one recommendation from the advisory committee reports, and that is the 5.2.1 municipal election student education. And it reads that Access, Barrie, and Legislative and Court Services Department be requested to work with Georgian College to encourage greater engagement of the student population in the municipal election. Can I have a member of the committee move this motion? Deputy Mayor, Acting Mayor Ward, thank you. Are there any questions from committee members? Seeing none. Any questions from members of council in attendance? Seeing none. All in favor? That carries. Thank you. And that takes us now to reports to committee. We have the 2021 year audited financial statements. Can I ask a member to put this on as put on the agenda? Can I ask a member of the committee to place the motion on the floor? Councillor Thompson, thank you. Are there any questions from committee members? Seeing none. Are there any questions from the esteemed council member in attendance, Councillor Riepma? All in favor? Thank you. So carried. And I think that our next item is 6.2, overnight waterfront parking and traffic bylaw updates. And it reads that traffic bylaw 2020-107 as amended be repealed and replaced with Appendix B to the report to the Finance and Corporate Service Committee dated May 31st, 2022. Can I have a member of the committee place the motion on the floor? Thank you, Acting Mayor Ward. Are there any questions from members of the committee? Seeing none. Are there any questions from members of council in attendance? I see none. All in favor? Unanimous, so it's carried. And that takes us to adjournment. This concludes the Finance Corporate Service Committee meeting. The meeting is adjourned.